Okay, hi everyone. I'm sorry that I can't join you. I'm actually in New York City. By way of introduction, my name is Seun Adebiyi. I'm a friend of Sunny's, and actually, I'm also a cancer survivor. In 2009, I was diagnosed with leukemia and lymphoma and told that I needed a bone marrow transplant. And unfortunately, I didn't have any relatives who were compatible donors, so I had to search the registry. That's when I learned that African Americans have less than a 17% chance of finding a compatible donor, partly due to the lack of Black donors on the registry, partly due to the greater genetic diversity within the African diaspora. Right around that time, I was introduced to Sunny, and I came up to him with a radical idea. I said I wanted to start a bone marrow registry in my home country of Nigeria. I had approached the US registry with the same idea, and they had looked at it realistically and said that this was something that would take several years, if not decades, to establish. But working in concert with Sunny and some of his young colleagues within the global health network that he established, we were able to get a fully operational and accredited registry in Nigeria functioning within 2 years. And this has been a case study in transdisciplinary professionalism because, as you know, I'm not a medical professional, but in setting up the registry, I work on a daily basis with medical professionals, not just in different disciplines, but in different countries. The complexity of a registry requires that we outsource a lot of operations to people from the Czech Republic to the United States, and we're also trying to expand the patients that we serve from Nigeria only to include other countries like Kenya, Ghana, and so on. The most important lesson that I have drawn from this, however, is the importance of being able to step outside of the trap of siloed thinking. Every person that I talked to before launching this registry and before meeting Sunny looked at the problem of starting a registry from the point of view of their own discipline. So the bone marrow transplant doctors looked at it from the point of view of a bone marrow transplant physician. The radiologists looked at it from their discipline. But there were very few people within the medical community who looked at it from the point of view of a patient, the ultimate end user of a registry. And I felt that this is an important case study as we have discussions around developing a new framework of thinking and collaborating between different disciplines, that the orientation, the end goal should be designed with the end user in mind, and that patients should have an important voice in developing this framework for collaboration.